Dr. Jon LaPook, our chief medical correspondent, has been covering the Zika story from the start. John, there is a new case of infection in Miami-Dade, but not in the community where the other infections were discovered. What does that mean?
Well, it's a non-travel related case. And the question is it an isolated case or does it represent a new cluster? We already know there's a hotspot of Zika infection. And what they're going to have to do is exactly what they did before, go door to door and figure out, are there people who are infected with Zika who don't realize it? If there are, then they're going to have to go in there and do exactly what they did before. They're going to have to get rid of the freestanding water. They're going to have to use insecticide both outside the house and inside the house, and also put down larvicide, because once the mosquitoes are killed, you have the larvae they can hatch, so you have to kill those too.
And there's the question that remains. What about the $1.9 billion that the president has requested, but the Congress has not authorized?
My colleagues in the health profession are beside themselves about this. Because imagine a place like Florida, which is relatively well funded and has a lot of experience taking care of mosquitoes and things like that. What happens if there's an infection along the Gulf Coast in a small town that doesn't have the kind of resources that Miami has? They may not even pick up the fact that there is an infection. And if there is an infection, then will they have the resources to really be able to go after it, go after the local mosquito population and get it all under control? We're talking about a mosquito-borne illness that causes birth defects. And for some reason, Congress can't get it together to allocate new funding.
Money that could make a difference. Thank you, John.
Thanks.
If you have questions about Zika and how to protect yourself, we have a lot of information on our website. Go to cbsnews.com/Zika.